chat with my colleague, if I try to say health equity is really important in Switzerland, they say, no, it's not. We don't have an issue of health equity in Switzerland. Right? So how do we bring the narrative forward? A narrative should say, we're coming from here, we're trying to get to here, and here's how we're going to do it. Help us. Right? So I think we had a lot of debate on what are the misconceptions that we're trying to knock down. You know, there are enough females in leadership today. What else do we need to do? Clearly, not only do we need to get women to leadership, we need to retain them. We need to be able to support them as they're there so they're not feeling like the single voice at the table. We talked about the misperception that women live longer, so therefore they must do better with disease. Right? We know in many cases that morbidity is much higher with females in a lot of these conditions. People just aren't aware of those facts. So what we did with the workshop was really try to make it tangible and meaningful for the people in the room. So we asked them to say, what challenge would you like to tackle in the next hour, hour and a half, as you think about that intersection of female health and ESG? Let me just pull up the topics that were addressed, and I won't have time to go through it, but each team came up with tangible roadmaps, plans, actions that they would take, which I think is really nice to be able to walk out of the room with.
Maybe, do you want to give one example?
Yeah, so I'll give the 5 that that the teams decided to focus on challenging. So one challenge in the morning was, how do we just generally drive awareness to improve the access and affordability of women's care? And the example that was given that we were talking about was a Swiss example. It was about care given at the pharmacy. And what can you do more to be able to bring care out of the pharmacy into the home? A lot of people don't want to talk maybe about their medical conditions, their female medical conditions right in front of the counter. Are there virtual ways you can provide that care? We talked about finding the right data and insights to provide at that point when they're asking the question. How do you provide the right mechanisms for that? Where is that trusted source of information? I think there was a lot of agreement that if I go to my hospital's website or Mayo Clinic or these kinds of things, I would trust that. So how do we insert that information into the sources that already exist? We don't need lots more new solutions or apps, but how do we strengthen the ones that are already trusted and in the marketplace? Another topic that was raised